Good evening, Springfield General. My name is Roberson. We're talking about communicating and managing change. The agenda will follow. Introduction, problematic issues, what went wrong, planned process change, summary, and we'll have a session for questions and answers. Introduction, Springfield Journal is a place of healing. Our goal is to cause no harm nor death due to preventable errors. We as a team must remedy some systemic problems we currently have with prescribing, administering, and the ordering of medication for our patients. This is not an individual problem. It's a systemic problem throughout the hospital. Therefore, it will take a team effort in resolving our errors in this area. We need to lean on each other to ensure our patients do not incur further damage to their health or death based on our inability to get their medication, prescription, and doses correct. Before I go into problematic issues, there was a study that came out Thanksgiving Day 2010. The headline was "Hospitals Make No Headway in Curbing Errors. Studies Show." After efforts of design and reducing errors, they found that the harm to patients was common and that the number of incidents did not decrease over time. We did not decrease the harm here at Springfield General. Instead of helping our patients by installing the new computerized physician order entry CPOE system to correct our previous errors, we doubled down on the mistakes that continue to impact our patients negatively. Like on the slide, we misinterpretations by physicians. We had incorrect dosage information, discontinuation failures, patient confusion, problems we thought we could fix with the system brought about more problems. Where we went wrong: diagnosis of the CPO to repair the original issues of the congruence of multiple drugs and the consideration to patient allergies and the unreadable handwriting by the prescribing physicians did not work. Why? Because the chief administrator cannot diagnose and issue a solution solo. There was no shared diagnosis. We needed the hospital staff, physicians, nurses, pharmaceutical representatives, warehouse, clinical reps, and any change agent to help in resolving the problems. We did not have a shared diagnosis. It was just one person diagnosing and solving. We had no dialogue sessions. We need patience with this process and allow for solutions to come forth, or possible solutions like redesigning. We had a lack of preparation, training and teams and facilitating. Implementing timing was off. We applied the solution too soon before we were ready. And communication and teamwork can improve. Next, planned process change. It takes a village approach to succeed. Systematic change in an organization takes a comprehensive review, not a quick fix. The most effective way to change organizational design is to be systematic and strategic rather than piecemeal and haphazard like we were, Springfield General. Springfield General's effective patient care can improve to meet our shared values. We have to work as a team. Driver of change process. We should never use technology as a driver of change. We put the cart before the horse to solve our problems here at Springfield General. Technology only reinforces the change required. Patterns of behavior. Change when our staff and employees are part of the solution. Spector said effective change implementation calls on new technology to enable and reinforce new behaviors. In summary, we will initiate a discovery process to guide us towards a systematic diagnostic framework. Once we have a group diagnosis, we will initiate a small change in one area of the hospital to test it prior, like a change pilot. The chief administrator will need a representative from each unit section involved to set up a team for immediate guidelines and actions to follow. Teams will establish temporary structure to facilitate verification of prescriptions written and within the system, interface between the warehouse, pharmacy, and the CPO to adjust dosages prior to giving to patients, and analyze medication prior to discontinuation, sub-review sessions for physicians and nurses to decrease patient confusion, set up mini teams to electronically integrate patient records properly by using other system inputs, flush out roles, responsibilities, and relationships to provide a template for discovery process. Remember, we are here to provide quality care to our patients, our customers, by efficiently working to ensure that medication is safe and timely. Now we can begin our question and answer session.